Hi, everybody. I'm so happy you came to join us today to hear from one of our national partners, the ARC of the United States. I'm Sharon Spurlock. I'm the Senior Director of Family Support here at the St. Louis ARC. I'm very delighted to introduce Carrie Hobbs Giddens, and she's here with us from the ARC of the United States. And I'm going to let Carrie go ahead and tell her a little bit about her journey with the ARC and get started.
Thank you so much for having me here today. I'm really excited to be able to present a little bit on the ARC Center for Future Planning. Just a little bit about myself before I get started. I began with the national office on May 9th of this year, so I'm still very new to the national office, but I've been with the ARC for a very long time. I started right out of college as a direct support professional, as so many people do in this field, and stayed at a local chapter of the ARC for 13 years, worked in residential supports, employment, vocational evaluations, work adjustment training, transition services, people with challenging behavior, senior programs, community-based day programming, just about everything that you can imagine. And then I took a short break from the ARC and worked for mental health for a short period of time, went to the ARC of Arizona as executive director, moved back to Indiana, which is where I'm from, and worked for a for-profit provider, home and community-based services, and created a statewide adult family care program for both seniors and then also people with disabilities. Then I went to the ARC of Tennessee and I was state executive director there for 11 years, took a 2-year break and worked in managed care to implement a home and community-based services program through managed care. And then I came to the ARC United States. So I'm really excited to be here and to work with the state and local chapters and work with NCE and with the national office, just to do everything we can to support our chapter network, because without you, it is really difficult for us to fully fulfill our mission. So thank you again for having me here today. And I look forward to answering everybody's questions. I am very familiar with the Center for Future Planning. However, I am not what I would consider the guru. That is Liz Mahar, and her contact information is at the end of this presentation, but I will do my best to answer questions as I can. And if I don't know the answer, I will get back to folks. So right now, we're going to cover just a little bit on the background of future planning. What is a future plan? And then the ARC's future planning resources. And so a really important part of future planning, it's about telling your story. It is about making sure that people who are supporting you and caring for you after your parents and your primary caregivers pass away or maybe no longer able to care for you. It's those little things that we forget about, like what kind of cake you want for your birthday or what your favorite holiday memory is or tradition is, that really make the best life for somebody. And so it was with that in mind that the Center for Future Planning came to be. Now, those aren't the only things that are important, but those are those key pieces along with some of the other bigger areas that we'll cover. And so, of course, the ARC is the largest national community-based organization advocating for people with intellectual and developmental disabilities. You can see we're pretty large, 174,000 employees. The 660 chapters is a little bit high at the moment. We are down to just under 600, so definitely need to update that. That kind of is a fluid number. We keep adding chapters and then some are merging and things like that. So we are definitely working to build that up. And so future planning is creating a guide for the person with intellectual and developmental disability. And again, it's wanting to lead a good life and be as independent as possible. And so throughout all stages of life, you really want to look toward that future, especially when that parent or other caregiver is no longer around. And so I'm going to skip this because I want to save it for other questions. But just think about for yourself, what are some of your hopes and dreams? What are some of the supports that you need to make those dreams come true? Because those are the things that you look at in the creating a future plan. And so there's some basic areas of future planning. Those include expressing your wishes for the future. So what does your best life look like? Where do you want to live? Are you going to continue living with family members? Are you going to live on your own? Are you going to live with roommates? What is that going to look like? And then where are you going to find the money to do that? So you have to be able to finance that future for yourself. And that could be a combination of money coming from different sources. And then who's going to help support those major and daily life decisions for you? Your employment, your other activities, and then also making sure that you have those strong social connections. And then really focusing on that person's life history and their story is what is critical, knowing what's really important to that person, and then having family and friends help figure out how they support that person to have that life that they want. And if you think about it, when you're looking at this, it is not that different from what any of us do. We just don't call it something formal, but in a lot of informal ways, these are the things that we do to ensure that we're having the best life possible. And so I mentioned briefly about where people want to live. And so you have these different options. And then how do you go about making that happen? Making sure that you're connecting with disability housing experts to find options in the community. Right now, housing tends to be challenging in a lot of places because the cost has gone up so much. And so being able to find affordable housing that is in safe areas can be challenging for people with IDD. Also, what kind of support needs do they have and how will those be met? We have an ongoing crisis for direct support workers. So looking at technology or other things that can help you support you in your chosen setting is something to consider as well. And then also going back to the cost and how those things will be paid for. And so when you look at financing your future, do you have basic funds available for the supplemental needs of that person with IDD? And then knowing that financial planning, it's knowing what kind of government benefits can you get. So are you getting SSI? Are you getting food stamps? Do you get Medicaid for your health insurance? Are there other types of income that you're able to get? Some people can get SSDI as well. So looking at those options. Also, if you're working, then that's another source of income. And then a lot of times people don't think that they have to plan because they don't have enough money. And they think that planning for the financing the future only matters if you have money. And that's not necessarily true. Everybody should have that comprehensive financial plan so that folks know where the money's coming from, where the gaps may be, and being able to plan for that. And so again, it's focusing on those public benefits, but also looking at other resources such as ABLE accounts, which are accessible to anybody. You don't have to have a lot of money to open an ABLE account. And also special needs trusts. And special needs pooled trusts are also options for people that don't have large amounts of money to save or to invest. And so then how do people get that support in making those daily life decisions, but also the major ones? And so practicing with your family member with IDD to help them make decisions, and start with those easy ones, everyday decisions. Where do they want to go? What do they want to have to eat for breakfast, lunch, or dinner? What do they want to wear that day? What sort of social activity do they want to do in the evening or on the weekend? And then help discuss with them how you're making those decisions and what supports that person needs. And sometimes it's just informal support. So the same things that we use, getting advice from others. I just texted a friend because we're getting ready to move. And I said, hey, do you have a moving company that you recommend? So we get advice from people all the time. We should absolutely expect people with IDD to do the same. Sometimes it can be technology, especially if they need assistance communicating with decisions. Some people need more formal support. So some people use rep payees for their government benefits, or they will use healthcare representatives to help them with medical decisions. Others use power of attorney. And then as a last resort, there is the option for guardianship and conservatorship, but it does significantly limit a person's independence. However, in some situations, if somebody is not able to express their wants and needs at all, it may be an option for that person and a need. And so if you look at employment and daily activities, what kinds of jobs are important to the person or other activities? And I think it's always important to ask people where they want to work or what they would want to do if they did get a job, rather than just if they want to work or not. Because I think given the choice, if we were completely financially independent and didn't rely on work for our income, some of us might choose to retire a little earlier or volunteer or just do some other things that are not necessarily paid employment, But the reality is that most of us do need to have paid employment to pay our bills. And so sort of that same expectation should be there for people with intellectual and developmental disabilities. And so asking those more open questions about what are they interested in, where would they like to work, what types of jobs do they think they'd like, often leads to having a job versus the do you want to work. And then what support would that person need to be able to participate in jobs or activities? Do they need a job coach? Do they need a job developer? Do they need a personal assistant with them? Do they need somebody to help them with those, not only the job tasks, but just those day-to-day activities if they are volunteering or if they're doing other social clubs or things like that? What is that level of support that they need? Social connections are critical, making sure that people are connected to their families, but also friends. And doesn't have to always be close friends, but just they go to the same grocery store, if they frequent restaurants, do they learn the names of waitresses? Or if they go get their hair cut at the same place, do they learn the name of the person who cuts their hair? Sometimes it is those things as well that can make somebody feel really a part of their community. And the more expanded social network they have, the better quality of life they will typically experience. And so then it's thinking about ways to involve the person in their community. If they're interested in going to church, that is a great place to meet people. There's always different activities going on and chances for you to meet people. If they have a specific interest, being able to volunteer, say at a food bank, at the Humane Society, even sometimes daycare will allow volunteers, or a school or a library. Looking if they're still in school, looking at those school activities and if there's clubs or sports or anything like that that they can get involved in. And so, of course, the ARC is an advocacy organization. So we want to make sure that people are aware of the ARC's Action Center, which keeps people up to date on our public policy issues, the National Council of Self-Advocates. So this is open to any person with a disability, whether or not you're connected to the ARC. And the council is doing some amazing work. They have been having really great meetings every month. And so this is a way to get involved with other self-advocates. And a lot of us have developed relationships over Zoom at this point. COVID changed a lot of the way we socialize with people. And so this is another way to connect with self-advocates. And then there's a recording from the ARC's last Advocacy Power Hour, and there will be another one coming up at the National Convention in November, which is in Denver this year. And so now I wanted to show a little bit about some screenshots about what the Center for Future Planning looks like. Now, this is a free resource to anybody. So if you're a person with a disability, if you're a family member, and you want to start this plan for a loved one, all you need to do is go to the Center for Future Planning website and you register and you are able to get started. And it is something that you don't need to do all at once. You can do it in chunks and then go back, you can change it. You are able to share it with other people. You can download copies of it if you're a person who likes to have the paper in front of you to reference. So there's a lot of great pieces to this center. And so one of the biggest things is where to start. And so as you go into the website, it's going to ask, who are you? If you're a parent, you would want to click here and it's going to take you down one path. If you're a self-advocate, it's going to take you down another path, and then sibling, older family or friend, professionals, or a staff at the chapter of the ARC. So depending where you click kind of depends on that next step then that it will take you in the process. And then here you can see all the different areas of future planning, which we discussed. And so you've got those wishes for the future. And again, those are sort of those dreams and those things, those little things that really make you happy. Your favorite time of year. I always say, what's your favorite birthday cake? Do you have a holiday tradition? Are there certain things that you would do as a family every year that's really important to you? Are there family member birthdays that you don't want to forget? Those types of things, you absolutely want to have those in there. But also those big dreams too about maybe where you want to work or where you would want to take a vacation or something like that. And then it does walk you through, like we talked about, deciding where to live. And so it will ask you a series of questions and then help guide you through that process. The same with financing the future. And then your employment and daily activities. supporting daily and major life decisions, and making social connections. And so you can work through each of these sections over time. And so then this is what the build your plan section would look like. And so you've got right here, you can see the supporting people, that it's a tool. And so you would click here on build your plan, and then it would start building out those different sections that we just covered. And then once you've created that account, then you can view this at any time. And so this is something that you can always update. And then you can also do a to-do list here within the build your plan so that you know if you have things that you have to do in the future. So for example, if you're an older person with IDD and you're getting close to 65 and you're not getting Medicare yet, and you have worked at some point in time, you would need to make a note that you want to sign up for Medicare and that you would want to sign up for Social Security. So those are things that are important. If you have certain things, if you want to use this for smaller things like annual physicals or things like that, you can add those to-do lists in there as well. And so this section, it goes back to that decision-making support and how to help them lead that good life. And so you definitely want to talk about supporting those daily and major life decisions. And so it's going through the different things about how that person does make their decisions. What type of help do they need? Are they somebody that needs to have comparisons and make lists like these are the good things about a decision, these are the bad things about a decision? Do they like to talk to multiple people and get that input? Do they have trusted people that they talk to for certain things? So it's really kind of knowing what that person needs. If the person doesn't communicate verbally, but they can still make their preferences known, what does that look like? If somebody uses eye rolls. So I had a friend of mine who couldn't speak verbally, but I knew if she rolled her eyes to one particular direction, that meant she supported something. And if she rolled her eyes another way, that meant she didn't like it. And then also from her vocal sounds, I could tell if she liked something or she didn't like something. And so we were able to communicate in that way. And so sometimes if you're supporting somebody around making decisions, it's also helping them be able to communicate those decisions to somebody else. And then also looking through here, it's looking at how you can build up the decision-making skills for that person. And again, it's starting with those small decisions. None of us learn how to make major life decisions right out of the gate. We start with small ones. We start with those decisions I talked about. What are we eating each day? What are we wearing? Where are we going? And then as we get into those more difficult decisions, like maybe you're faced with a medical decision and it's whether or not you're going to have surgery. What does that look like? Is it talking to your parents about it? Is it getting opinions from others who may have had the same experience, but helping to figure out what that looks like and then writing that down so that somebody else is able to understand that. And so you can see here around the major decisions, it's saying right now they have somebody on their team helping make the decisions, but this would have those different kind of possibilities here. So here they're making their own decisions, here they're getting some help, here somebody's making the decisions for them. And if they're under 18, of course, their parents are still the ones in charge of those decisions. It doesn't mean they can't get the input of their child, but ultimately the parent still makes the decision. I had a coworker of mine when I was at the ARC Tennessee. He has intellectual disability, and he was a master at kind of creating his own network to support him to make decisions. And so his sister was the one who helped him with all his healthcare decisions. She made sure he got to the doctor. She laid all the pros and cons out for every decision that he made. I was the person that he went to for his benefits, because he would get letters from Medicaid in the mail. And of course, we all know that Medicaid is typically not good at writing letters that anybody can understand. And so I would be the one to read the letter and then translate to him what it meant and whether or not he had to take any action based on what was in that letter. He had another coworker who helped him with his transportation to get to and from work, to make sure that he had called Access Ride, that it was scheduled at the right time. And so he got his support there. And then He even had support for somebody to hem his clothing. And so he had his own personal, it was another coworker at another organization. So he was really good at piecing all these things together to get the support that he needed to make sure that he was living that good life.
Those are such great examples of the way to get supporters on your side and kind of to clarify what each person's role might be. We did have a couple questions that I think you've answered, but I just want to clarify that this resource is free and you don't have to be a member to use this. You can go on and create an account and it's yours. So just to clarify, thank you, Carrie. Sorry.
No, that's okay. You're correct. And nobody else can access it but you. So I think that's the other key point to bring up is that by you creating this, unless you give somebody your access information, the ARC can't go in and look at any of this. So this is uniquely yours. And so then expressing those wishes for the future. These are just some of the basic information, of course, that everybody needs to know. And so this will have all this information for whoever needs it. And then for anybody who accesses the website, but they have an urgent need. So if they're in crisis, there is a section to actually say, start here. And so if anybody's in crisis or has an urgent need, they are not going to go through all these different sections and plan out a future plan at that point. And so this way it's giving them those links to get in touch with the ARC or also your state IDD agency so that they can help get you moving there. And then also if looking into benefits if they don't have those currently. So we wanted to make sure that those pieces are there. And so there's some other resources as well. And so within the Center for Future Planning, there's videos and stories from self-advocates who have done their own plans. There are 9 plain language documents. And then there's some new detailed sections about Build Your Plan. And I've been around the Center for Future Planning since it started. I was on their original advisory committee, and the way it is set up now, in my opinion, is a lot simpler than it was when it started. And so I think one of the things that we learned over time is that while you want to be comprehensive, comprehensive is also overwhelming. And so we didn't find people necessarily engaging in the center as much as we would like, because I think they would get started and then it was just so much information and so much content that people kind of just got stopped in their tracks. So I think the way it's set up now feels a lot more accessible to people and helps people feel like they can actually get this done and then be able to use it. And so, as I mentioned, Liz is the expert for the Center for Future Planning. So I do have her contact information here. And I think the one other thing that I wanted to just bring up with the Center for Future Planning is that if somebody goes in and they spend all this time working on it and you're developing this plan, make sure that it's a living document. Don't just create it and then leave it sit there. Make sure that it is part, if your family member is getting services from a provider, that this plan in whatever parts you want to share, but that it's referenced, that it's looked at on a regular basis, that people are using it as a guide so that it is a living document. If you're going to put all this effort into it, you might as well make sure you get everything out of it that you can. So make sure that you are taking it and using it. And then also if there's things over time that you realize we should have in here that we don't, please give that feedback to Liz, because I think those are things that help us to keep improve the center as we move forward.
For families that are listening and individuals that are listening, just know if there was something that was really interesting to you that Carrie was talking about in the different sections, you know that there's a lot of resources here. So you can go back and watch a video about financial planning or a video about options for independent living. You could join one of our Planning Forward groups where we're going to walk you through these individual sections. And Anne and Marianne actually use videos from the Center for Future Planning to show you what some of the different topics to guide you through those. And then finally, we have family navigators that are available at every age range. And so our navigators can help you log on to that website and start filling in your documentation at a one-on-one level. And just for clarity, I want to say that a lot of you have been exposed to the Life Course Online platform. That's another alternative we have in the state of Missouri. Sherry for saving your planning information and for creating, I love the term living document, something that you can continue to let grow and add to and share with other people. We don't care what format you're using. We want to support you where you are. So let us know if you need some help, and we're happy to engage with you on that. And just one more plus for us, we have gone through training with the Center for Future Planning. So we are certified future planners and are here in whatever way you might need.
Great. Well, thank you. And I'm really happy that you brought up the Life Course tools online. I was this close to bringing them up. And so I'm glad that you did, because I think that they're an excellent tool. They're a great resource, and they're a great companion to the Center for Future Planning as well. So happy to hear that you feel the same way.